Today, I want to talk with you about the new Trump administration's intention to repeal and replace the Affordable Care Act. I call this short video the Republican Conundrum. First, a little bit of history. During the almost 7 years since the passage of the ACA, or Obamacare, Republicans have maintained total agreement in their hatred of the legislation. In particular, its fundamental reliance on taxpayer-subsidized health care was an abomination to most Republicans. Following its passage, House Republicans repealed the ACA over 50 times. Likewise, public opinion polls consistently rated the ACA unfavorably, with approval ratings rarely exceeding 50%. Although most Americans don't understand the law, they understand quite well high deductibles, surprise medical bills, and the cost of prescription medications. In spite of its problems, the ACA did have some successes, notably in extending health coverage to about 20 million previously uninsured Americans. Under Obamacare, for the first time, insurers no longer can deny coverage to anyone based on their current health status, a valued protection for the 133 million Americans with chronic illnesses. Donald Trump declared from the outset of his candidacy that he would repeal and replace the health care law with something far better. President Trump promised to keep the most cherished pieces of Obamacare, the ban on pre-existing conditions and the ability for young adults to stay on their parents' plans. This pronouncement fundamentally shifts the nature of the health care debate in this country. Politicians, even conservative ones, now view access to affordable health care as a right not just for the elderly and the desperately poor, but for all Americans. So, in 6 short years, the core elements of Obamacare have become the new normal. Although Obamacare still divides Americans, more of us now worry about losing coverage than repealing the ACA. So this brings us back to the Republican conundrum. In order to convince insurance companies to provide coverage for Americans who have pre-existing conditions, there has to be some way to compel healthy people to buy insurance. The math of insurance just won't work otherwise. Lower cost healthy people must subsidize coverage for sicker people who use more care. And healthy people won't buy insurance if they can't afford it, which means that government has to help out with providing some kind of subsidy, and probably a large one. The political battle going on now in Washington is how to structure and decide who is going to pay for a plan that maintains the promises of Obamacare and yet moves away from a top-down government program. Insurance companies know this, and they're getting nervous. For Republicans, the challenge of repealing and replacing the ACA without causing voter backlash, increasing the federal deficit, or throwing the health insurance industry into turmoil is proving just as complicated as it sounds, and that is a conundrum. That's all for now. I'm Carolyn Engelhardt. Thanks for listening.